Basically, what we're seeing is WHO would have had a high-level meeting with the health officials from China and, of course, other government officials, basically telling them that WHO would like certain data sets from them, of course, aligned to increased levels of sequencing of what is going on in China so that they can disseminate that to other member states so we all are on the same page and know exactly what is going on. What we're seeing on the outside of it is increased number of cases, increased number of hospitalization, and of course deaths to go along with it. So that is what the world knows. WHO is the intervening body that has to now go to China and say, we need this kind of information to send to our member states. It is difficult for other member states to go to China in that regard, or any other member state for that matter, and ask them for data about their present epidemiological outbreak in their jurisdiction. So we leave that to WHO. Having said that, as you said, a number of countries have already put restrictions on China in terms of travel. So you look at the US, the UK, Canada. And to get to Trinidad and Tobago, you have to go through those jurisdictions. So it gives us somewhat of a buffer in terms of people coming from China. So those restrictions being in place acts as a filter to some extent, so that we know that those persons that are coming have presented a negative to US, UK, or China, or they like already, and are in a different state when they get to Trinidad. So there's some filtering in terms of the traveling population.